Hello, everyone. While we are waiting on more people to join, if you could just please enter your name in the chat box. And if you are new to our meetings, please also enter your agency and email as well. We'll get started soon. Hi, everyone. If you are just now joining us, please enter your name in the chat box. And if you're new to our meetings, please also enter your agency and email. And we'll get started in just another minute. All right, let's go ahead and begin. So just so everyone knows, this meeting is being recorded, and please keep yourselves muted until it's time to introduce yourselves. So welcome everyone. Thank you all so much for joining us today for our 4th virtual Healthy Communities Coalition meeting. And before we get into the agenda, Sue would like to make an announcement.
Good morning, everybody. It's nice to see you, that I can see your smiling faces. I'm the Executive Director for Healthy Communities and wanted to say we are so excited that Rose Joyner has joined our team. And she'll be splitting her time between the Covering Kids and Families, and will also oversee the youth portion of our tobacco program. So Rose, would you like to introduce yourself?
Good morning, everyone. My name, as Sue has said, is Rose Joyner, and I am very excited to be working for Healthy Communities of LaPorte County, and also working with the partners with both of the programs, the tobacco program for the youth, and also working with our families and ensuring that they have health coverage. So thank you.
Awesome. Yes, we are very happy to have you, Rose, and we know you're going to be a great asset to our team. All right, so we'll jump right into introductions and sharing. I will call on each of you to introduce yourselves and share any announcements you'd like with the group. I will go ahead and start us off. My name is Melina Rivera, and I'm the Tobacco Program Coordinator for Healthy Communities of LaPorte County. I sent you all a survey to collect your contact information a few weeks back. Thank you to those who were able to respond. And for those who gave me permission, I am working on compiling everyone's contact information, and I can share it with the entire coalition so you all can connect with each other outside of these meetings. I also wanted to give a tobacco update that some of you might have heard in the news. So the FDA is now starting to ban menthol and flavored cigars. And that's in the making now. So for those of you who are not familiar, menthol is a minty flavor that makes it easier to start smoking and harder to quit. And the FDA made this decision to ban menthol in response to a petition submitted to them over 7 years ago by 19 public health organizations. So this response was long overdue, but it's now finally happening. And this is a huge win for health equity within commercial tobacco control. So we can all celebrate to that. And just for some background, the reason why this ban is such a huge step for health equity is because the tobacco industry aggressively and disproportionately targets Black communities for marketing their menthol products. And as a result, there are many major health disparities among the Black community regarding smoking menthols. So this ban is much needed. The rulemaking process for this ban can take a long time. And while the FDA said they would issue proposed rules within the next year, we definitely want to urge the FDA to expedite this time frame and move swiftly to propose, finalize, and implement the necessary regulations to turn this decision into life-saving action. And this ban came at a great time because May 16th is No Menthol Sunday, which is a national observance day led by the Center for Black Health and Equity. And it's an opportunity to engage faith leaders and their communities in a discussion about how to improve health outcomes for African Americans, particularly regarding quitting tobacco and bringing awareness to the role menthol and other flavors play on tobacco addiction. So at least now in their discussions surrounding No Menthol Sunday, we can finally say the FDA is committing to remove menthol. So that's great. But the fight is not over. We can be sure that the tobacco industry is going to try everything they can to derail this ban. So the FDA needs to act fast, and we need to do everything that we can do on a state and local level to address menthol, such as reaching out to our legislators to show our support for a local ban, and reaching out to the FDA to urge them in expediting their rulemaking process. So that's it for my tobacco update. And finally, I just want to plug one more thing. As part of my tobacco work plan, It includes training organizations that serve low-income communities on the Breathe Healthy Steps to Living Tobacco-Free curriculum. And it's a free training and program with the goal of helping parents understand the impact of secondhand smoke and the importance of a smoke-free environment for their children. So if your organization is interested in getting trained on the curriculum, please let me know and I'd be happy to host a training for you. That's it for me. I'll pass it over to Sue. Let me see if I can ask to unmute you. Oh, Sue Reed is who I'm referring to. 1 second.
There we go. Melina, do you want to go into introductions first?
Oh, it's your turn. Yeah, you can start with the Leeds fundraiser.
Sure. So if you haven't heard, Leeds Public House right here in Michigan City is doing their libations for donations to support healthy communities of LaPorte County. So they've created, and this is the first time because we are a health organization, we asked them to create a mocktail as well as a specialty cocktail. And when you go in there and purchase either of those items, 50% of the proceeds will benefit healthy communities. And those proceeds are earmarked 100% for the work we do with covering kids and families. We know that during this pandemic, health insurance is critical, and we don't know the long-term effects of those that were affected with COVID. So I think we're going to be seeing some health issues for quite some time. So we're really excited about this. So take your team, your family, head over to Leeds. They have fantastic food. A friend of mine actually that lives in Hobart came out over the weekend and just raved about the cocktail. It's a Beretti, it's Tito's vodka, lime soda, topped with Prosecco, and a raspberry sorbet. So then obviously the mocktail doesn't have any of the Tito's. So you can go at lunchtime and have a mocktail in lunch or go for happy hour. But we really appreciate any support you can provide, and please help us spread the word. Thank you.
Rose, I know you already introduced yourself, but would you like to share an update?
Yes, I would. The 2021 Indiana School Network Virtual Conference is June 22nd and June 23rd. It will be virtual, and Melina can send you the link. There are 5 areas that will be covered at the conference this year: administration, school-based health centers, health and behavior health, outreach and enrollment, policy and advocacy, whole school, whole community, whole child. So there are 5 areas. There will be 3 keynote speakers within the 2 days. As I stated, Melina can send you the link so that you can register. Thank you.
And I think Doris, who is actually joining us from Covering Kids and Families, just put the information for the conference in the chat box. And then Doris, would you like to say anything additional about the conference?
Hi, everybody. I'm Doris, and I'm with the State Office for Covering Kids and Families. And I have the pleasure to support the good work of healthy communities and other agencies around the state who are doing the important work of getting Hoosiers connected to healthcare coverage. The School Health Conference, if you haven't been before, is awesome. We've always had a good representation, specifically from Michigan City school nurses, but everybody is invited. Since it's virtual, you can, it will be open for a full year, and you can actually still see last year's virtual conference as well. It's completely free. So you can go in and visit one session or visit them all. And even if you're not working directly in a school, I think just about everybody's going to find something of interest. Thank you.
Great. Thank you so much. All right, so now I'm going to start calling on you all to go ahead and introduce yourselves and share any updates you'd like. So we'll start with Amina Starks.
Hi, I'm Amina Starks. I'm Assistant Director for the Otis R. Bowen Center.
Uh-oh. Amina, are you still with us?
Yeah, I'm like driving, so I'm about to hit a bad spot, so I'm going to end there.
Okay, thank you, Amina. All right, so we'll go to, I see Raymond's iPad.
Hi, I'm Ray Ginsberg from the Samaritan Counseling Center. I have to leave the meeting at about 10:30 due to another commitment. We have no events or anything special going on. If anybody knew or knows Nola Gertner from Michigan City, she used to be on our board anyway. Her husband passed away. So she's a very active woman in the community. Thanks.
Sorry to hear that. Thank you for sharing, Ray. Tammy Garrett.
Hi, my name is Tammy Garrett, and I am a provider engagement specialist for CareSource, and I don't have any updates at this time.
Thank you. Abby May.
Hi, I'm Abby May. I'm the program director for Michigan City Area Schools Safe Harbor After School Program. We provide after school programming to 9 of the 11 schools in Michigan City Area School District. We serve K through 12. We also provide before school services at 5 of the elementary sites. We are currently working on wrapping up the school year and landing the plane with compliance to all of our grants. It's been a crazy year. And we're excited to say that we'll be able to run summer camp programming for elementary and middle school students this year. We traditionally run a 6-week elementary camp, and we were not able to last year. We were only able to run a virtual camp, which is just not the same. But so we're very glad to be back in person for summer camp, 6 weeks with elementary students this year, and we are running a 1-week middle school STEAM camp with the morning hours focused on robotics initiative, and each afternoon featuring a different hike in the Michigan City and surrounding area, utilizing the Plant Wizard nature curriculum. Those registrations can be found on our website, educatemc.net/safeharbor, and we are currently taking enrollment.
That's awesome, Abby. Thank you. Brittany Pickett.
Hi, my name's Brittany Pickett. I'm with Anthem Indiana Medicaid. And really, I just want to let everyone know that I am here to work alongside you. You guys work with a lot of our members. We have a high concentration of Anthem Medicaid members in Northern Indiana. And so if you're ever working with someone that has Anthem Indiana Medicaid and maybe they're having an issue, or maybe you're just struggling getting them connected to services, please don't hesitate to reach out to me. I can put my contact information in the chat. I'm here to help. We have a wide variety of, we all know of Medicaid as the traditional medical insurance coverage, medical, dental, vision, that sort of thing. But actually the MCEs, which Anthem is one, we actually get to offer additional benefits to members like free Boys and Girls Club memberships, healthcare items, gym memberships, etc. So definitely would love to come alongside you to make sure our members are getting the things that they need in order to stay healthy.
Awesome. Thank you, Brittany. Catherine Heath.
Hello, I'm new to the group. I'm actually the director of the Cancer Center here in Michigan City. I've been in my post now for about a year. So just kind of getting into my role. I don't have a lot of updates, but I can tell you that Kelly Oliver and I, she's on the call, is working really hard to develop an Aspire program here with Franciscan so we can kind of better serve our patients in the community with an Aspire program. We're not up and running yet, but can certainly keep the group updated on where we are so when we can start seeing patients here. We're going to focus that program here at the Cancer Center. Typically, our smoking cessation has been done through our cardiac services department. So we're trying a new angle. So hopefully we'll be able to reach more patients this way. And that's all I really have. I'm just here to be a part of the group and help out any way I can.
That's wonderful. Thank you, Catherine. All right, Dawn B.
Hi, I'm Dawn Bila at Futures Case Management. I'm the Director of Aged and Disabled Services. We provide case management for individuals on the Medicaid waivers in Indiana. And the announcement I have is oddly self-serving, but as Futures continues to grow, we have an Assistant Director of A&D Services. So there may be times where I'm called to do other things and my assistant, Nazia Ibrahim, will be attending in my stead. So I wanted to make you aware of that. And thank you for, I'm sure you'll provide her as warm welcome as you have me.
Thank you. Ebony Neal.
Hello, I'm Ebony Neal, the Family Resource Specialist for the Healthy Families Program at Dunbrook. We don't have any updates. We do have that parenting education program. They provide nurturing training for either small groups or individuals. So if you are interested, you can contact Nikki Williams at Dunbrook.
Great, thank you. Elizabeth Downs.
Good morning. I'm Elizabeth Downs, as you just heard, and I work for General Insurance Services. I work with Medicare and individual insurance as well as worksite wellness. So I kind of tap into all of these different categories we look at on the coalition. So I don't have any announcements though.
Thank you, Elizabeth. Jamie Fair.
Hi, I'm Jamie Fair. I'm Assistant Care Coordinator for United Way of LaPorte County. I'm about to share a link for the upcoming annual golfing outing. Let me see. I'm gonna try to share the link that they have coming up. Other than that, I really don't have any new updates. My position may end at the end of June, so the position is grant funded. So this may be my last meeting, it may not be. But till then, that is all. See if I can share this link.
Thank you, Jamie. Jen Carroll. Jen, are you able to speak? We will go back to you, Jen. Camila.
Hello, I'm the Health and Special Services Director at Paladin Head Start of LaPorte County. Right now, our updates are that we are accepting enrollment for the 2021-2022 school year for Head Start students. And we are also working on wellness plans to send home with the kids for the summer.
Awesome, thank you. Kelly Oliver.
Hello, this is Kelly. I am the lung nurse navigator with Franciscan Health Michigan City, and I am located at the Woodland Cancer Care Center. And as Kathy said earlier, so I'm the Aspire program coordinator, and we are working on getting that Aspire program up and running for smoking cessation for our patients and, well, eventually anyone in the community who would like to join our program. I don't have any updates as of yet, but once it is up and running, I will definitely let you all know.
Thank you very much. Rebecca Herney. Oh, you might be on mute, Rebecca, or actually, maybe you're not connected to the internet audio. Ah, looks like we're having audio issues. We'll try to come back to you, and you all who are having issues with audio, please feel free to put an update in the chat as well.
Can you hear me now, Melina?
Yes.
Okay, there, I fixed it. It was on my end. My apologies. I'm Rebecca Herney. I'm with HealthLink. I am as well new to the group, so I hope I can bring some insight or whatever it is that you would like for me to bring. I'm the Assistant Operations Director here at HealthLink in Michigan City. Not many updates for us. We are a vaccination clinic, so if anybody's interested in COVID vaccination, we do have that available and have appointments available. And for the month of May, we are doing a cervical breast cancer screening event for all ladies that want to come through here to get that taken care of.
Awesome, thank you. Let's see. Rochelle.
Hi, I am Rochelle Andruskevich. I'm a nurse home visitor with Nurse Family Partnership, which is implemented through Goodwill. We are a program that serves first-time low-income moms through their pregnancy and until their baby turns 2 years of age, just to provide them with resources that they need to have healthy babies, healthy pregnancies, healthy mamas, and then provide or promote self-efficacy. I believe we're only about a year and a half in the community. We've got 50 spots available for our clients, and I believe we're about 80% capacity now after a slow start that first year. But we're hosting support groups for our moms. And then we've also started I believe it's one Thursday evening, a support group for any mom in the community that wants to join via Zoom. So.
That's awesome. Thank you, Rochelle. Susan Enamorado.
Hi, I am Susan Enamorado, and I work for Indiana Minority Health Coalition as for community doula services, and I do not have any announcements right now.
All right, thank you. Tay Leftridge.
Hi, my name is Tay Leftridge. I am here today because of Ms. Sue Reed. I just recently started in this position as the community healthcare worker for Artemis for Women, and we work with high-risk women, pregnant women in Porter, LaPorte, and other surrounding counties. And so I just wanted to come today and see how I could be a part of this group and network with some new people. I've only been in this position since November, so this is all new to me.
Great, thank you, Tay. I think I called everybody. Is there anyone I missed? Actually, let's go back and see if Jen Carroll is able to speak.
Can you hear me?
Yes.
Okay, wonderful. Sorry about that. My name is Jen Carroll. I'm a social worker at Open Door Adolescent Health Center. And at this time, we don't have any announcements. but I'm happy to be here to listen to what everyone else has got going on. So thank you.
Thank you, Jen. Is there anyone else I missed?
Hi, I'm Denise Beck from HealthLink. I'm the community health worker. I popped on a little late, so you didn't miss me. So I help to connect patients with resources and help them address social determinants. Yeah. Yeah.
You're a little muffled, Denise.
Oh, sorry. Yeah, so I just help connect patients with resources.
Awesome. Thank you, Denise. Anyone else? All right. Thank you everyone for sharing. I'm happy to see new people join our coalition. Welcome and thank you for being here. So to lead us into our next agenda item, I wanted to first recap last month's cultural competency presentation. So the reason we had a cultural competency presentation was for two reasons. One, it was highly requested on a survey sent out to the coalition a few months back. And also because we are really trying to hone into health equity, and cultural competency is an important piece under health equity. So as a reminder, cultural and linguistic competency is behaviors and attitudes, as well as policies, practices, and procedures that enable effective work in cross-cultural situations. So when providers do not continually address cultural and linguistic competency, then they cannot have full capacity to adequately serve their clients. So with that said, in the work that we do, we have to make sure we are being as inclusive as possible. And if we aren't inclusive, that can feed into health disparities, and we definitely don't want that. So we have to make sure that all of our clients and coworkers feel seen, heard, welcomed, and cared for. So part of being inclusive is being very aware of the potential impact we have on others, including what we say verbally and non-verbally. And so that's a great segue into what I wanted to speak about today, which is microaggressions. Does anyone know what microaggressions are? Any idea? All right, so it looks like we'll all learn something new today. So the definition is microaggressions are everyday slights, put downs, and insults that marginalized people experience in their daily interactions. So microaggressions are often linked to our implicit biases, and they occur outside of our consciousness, and they may be unintentional. And microaggressions may occur verbally, such as "you speak good English," or non-verbally, such as clutching one's purse more tightly when passing a Black man on the street. So microaggressions can make people feel shamed and dehumanized. And while microaggressions are often unintentional, they can have a huge and negative impact on others. So now that we all know the definition, I would like us to watch a TED Talk video to explain microaggressions even further. It's a 9-minute video, but extremely interesting and informative. And the speaker's name is Tiffany Alvoyd, and she's an attorney. And she earned her JD degree from UCLA and has a concentration in critical race theory. And she created a training about addressing microaggressions in the workplace. And in the video, she does a really great job at explaining microaggressions, giving more context and examples. So let's go ahead and pull that up. I'm going to share my screen.
Formal definition of a microaggression is listed behind me. Simply put, microaggressions are insults that are rooted in stereotype and they're directed at someone because of their membership within a marginalized group. Now, because they are rooted in stereotype, they limit a person's ability to be able to see people as individuals. In 1970, Dr. Chester Middlebrook Pierce, a professor at Harvard, coined the term microaggressions to describe insults and dismissive behavior he witnessed Black people enduring. But now the term has been expanded to include offensive comments and behaviors that are directed at anyone in a marginalized group, including but not limited to women, people of color, people with disabilities, and people who are older. So one of the things about microaggressions is that they're very prevalent in society, and I could do a full day's discussion about that. I actually developed a training that I share with companies to help them address offensive comments in their workplace. We're just going to go through a couple examples here today, but it's important to note that we all have biases, and anyone can be guilty of making a microaggression or being subjected to one. So why does it matter? Well, for some people, just being themselves can be a revolutionary act because their very being is crushing stereotypes of who and what they should be. Microaggressions wound people. If we were to compare it to getting a paper cut, one paper cut is manageable, but paper cuts all over your body is something quite different. And it's this accumulation of offensive comments in social settings and professional settings that begin to take a toll on a person's spirit. Microaggressions can be an amorphous concept, but it's my hope through the examples I'm going to provide for you that I can provide a more definitive understanding. Microaggressions regarding disability are prevalent. For example, making comments like, "I'm so OCD about my files," or "ugh, I can't read today, I'm so dyslexic," when someone does not actually have dyslexia or OCD, can be perceived as a microaggression. These phrases are examples of ableist language, and they trivialize something that is quite serious. For some historical context, I want to discuss what happened when the Americans with Disabilities Act was signed in 1990. The ADA makes it illegal in employment to discriminate against someone because of a mental or physical disability. It also guarantees access to buildings and to public and private transportation. Shortly before the act was passed, several disability activists came to DC and they climbed the 83 steps outside the Capitol building. They met at the base of the stairs and they got out of their wheelchairs, they took off their crutches and any kind of assistive walking devices, and they dragged or crawled themselves up all 83 steps. Now, I like to share this story because it's a good reminder about the historical exclusion that people with disabilities have had to face. And it's also a good reminder that there was a group of people that felt so disenfranchised, so marginalized, and so unseen, they felt the need to do this. Microaggressions regarding race are also very plentiful. Some people might be surprised to know that professing colorblindness can actually be a form of a microaggression. Examples would be, "I don't see color. I was raised to treat everyone the same. I work in a diverse environment. I was in the Peace Corps." It's important to know, that is funny. It's important to know that mere proximity to people of color does not make someone woke. Nor does it make them automatically knowledgeable about social injustice issues. These comments actually deny the existence of people of color's experience in the world. And me personally, I've seen these phrases used in a defensive posture when someone's being challenged about something that they may have said that's offensive. What it actually does is shut down this conversation and it allows stereotypes to continue. The last microaggression that I want to talk about is the phrase, "that's so ghetto," or "that's ghetto." Now, Saturday Night Live has done a sketch about this phrase, and it's tossed around in the workplace and in professional settings. But this phrase can be very offensive to people, and I'm going to provide some historical context as to why. So the word ghetto is an Italian pronunciation. The word is used in 1516 to describe an area of the city where Jewish people are living in the city of Venice. Then in 1899, the word is being used to describe where minority groups are living in the city. And again, it tends to be a low income area. From a US perspective, the word has been associated with Black and Brown people who live in low income areas. What we're essentially talking about is a place in the city where people are being regulated because of poverty, disenfranchisement, and reasons that point to systemic racism. Now, when I'm talking about systemic racism, what do I mean by that? Well, the GI Bill would be a good example. In 1944, President Roosevelt signed the first version of the GI Bill into law. And that bill essentially made it possible for veterans to go to college and also gave them the ability to get low interest mortgages, which this sounds like a really good program, and it is. Unfortunately, the way it was administered, it was very discriminatory to Black veterans. The Veterans Administration refused to guarantee loans for developers who plan to sell homes to Black people. When I'm talking about systemic racism, I'm also talking about redlining. Redlining is the practice of drawing a circle around Black and Brown neighborhoods and then refusing to give loans to those areas. What I'm also talking about is pushing and shuttling people into a specific area of the city and then setting up situations so that the property remains undervalued. When people use the phrase, "that's ghetto" or "that's so ghetto," it's a way of making fun of someone or something. And for the reasons I just shared, it's not funny. So now that I've given you a couple examples of what a microaggression is, I want to give you a couple tools to avoid making these kind of comments in the workplace. The first tool or tip is pretty simple, is pause. Before you ask someone a personal question in the workplace, pause. Before you compare someone to something or to someone else, pause. Before describing someone's personality, pause. And when you're pausing, think to yourself, what could potentially be the impact on what I'm about to say to someone? Not just my intention, but what could be the possible impact of the way this person could take what I'm saying? Could they be possibly offended? The next thing I want to think about is this comment necessary? Is it promoting a growth mindset? Because remember, my number one priority when I'm at work is to be productive. The next thing that you can do to try to avoid making a microaggression is research. As I discussed in the previous example about "that's so ghetto," a lot of American English is slang. So before adding a new word to your vocabulary, just do a quick Google search, just to make sure that what you're saying is not offensive. So before I leave here this afternoon, what I want to leave with you with is, during the course of this conversation, I've been talking about inclusion and respect, which is important, and I hope that you leave this talk with that understanding. But I hope you also took from this talk the concepts of kindness and human decency. Thinking about something before I say it, that's a form of kindness. And treating people the way I want to be treated is one of the highest forms of kindness. Thank you.
All right. So I wanted to see if anything stood out to anybody that they'd like to share with the group. Any thoughts?
Hi, this is Tay. When I was listening to her talk, there were a lot of things that as soon as she said them, like for instance, this one is said to me all the time when I see color, or I don't see color, I just see the person. I think that we have gotten to the point where these things are so normalized that we don't speak up about it, and so it's interesting because I never really thought to say to them, this might not be something you want to say to people because, so it's just interesting. I really enjoyed that video and I appreciate you sharing it. Thank you.
Absolutely. Thank you for sharing. Anybody else want to share?
I can share. This is Amina. I've done this training before. Sorry when you asked, did anybody know of microaggressions? Of course. Some of the ones that I have heard is when I'm with a group of Muslims, it's like, oh, you guys are Muslims. I'd like to know more about you, but not you, right? So not the Black Muslim, but the other multicultural Muslims that are there. That is so highly offensive. Or what is that on your head? Like, do you have any hair under there? It's like all of these different little things. It's like a tech that keeps picking and scratching away from you. And I think people of color experience it almost on a daily basis. And you can, as Tay said, become so numb to them because they're so common in the American culture. I've made it a mission to just educate people that I come in contact with. I'm not too offended most days. I find it as a period to teach a lesson to somebody, give them some more information, because if we don't begin to speak up and say things when we're feeling these microaggressions, we will leave people in an ignorant state.
Absolutely. Thank you so much for sharing that, Amina. I definitely agree with you. For me, the video made me think of microaggressions I've also experienced in my life. And a big one that I encountered many times growing up and even currently is that people would come up to me in public, complete strangers, and ask me, "What are you? What are you?" And at first, I didn't even know what they were asking, but it always ended up being that they wanted to know about my ethnicity. And when I was younger, I really didn't think about it too much. But as I continued to get asked that throughout my life by strangers, I started to ask myself, why do people need to know that? And why is that the first thing that they think to bring up to me? I would think, would that person go up to a white person and ask, "What are you?" Probably not. So now when someone asks me that, I feel like they are not seeing me as a person. They are just seeing me as something that needs to be labeled. And in my head, it comes off as, you don't fit in the box I call the norm. So you need to help me label you so that I can feel more comfortable. So I totally get what Tay and Amina are saying. And these microaggressions can be about race, but they can also be about religion, like Amina was saying. Can be about so many different things. And Tiffany said in the video, they probably didn't mean any harm by it, but the point is that we need to be cognizant of the potential impact our words and gestures can have on others, especially in the field that we all work in. And it's easy for people to dismiss microaggressions and say they're being too sensitive, or she was just curious, or it was meant as a harmless question. But these things add up daily, every day. And at the end of the day, it's all about intention versus impact. While our intentions may be good, the impact it's having on other people should ultimately outweigh our intentions. And you can have the best intentions in the world, but if it's causing harm, then we need to rethink things. So like Tiffany said, pause and think to yourself, what can potentially be the impact of what I'm about to say? Pause, is this comment necessary? Pause, is this comment going to be productive? So I challenge you all, myself included, to try to pause before speaking We're all human and we all make mistakes. We all have done this, I'm sure, but we can become better. And yes, these conversations are uncomfortable, but they're supposed to be. And I've always been a huge proponent of challenging myself to lean into my discomfort, as Amina was saying, because from leaning into your discomfort, that comes learning and growth. So I hope you all learned something new out of this that you can all apply in your work life, but also your personal life. And I challenge you not to just pause, but also lean into your discomfort. I think I saw a hand raised.
That was me,
Would
Jenny.
you like to speak?
Because you all brought up, it made me think about my daughter. She's 18 and she's in the Valpo school for the, what is that? The Porter, I guess I shouldn't say their name, huh? Because I'm about to talk about them. But but she experienced that. She stays to herself. She's there to get her CNA for her graduation. And she stays to herself, but sometimes she wears lashes, right? So the teacher would call her out on her hair or her lashes, or she went late one day and the admissions, the lady at the desk, she'd say, well, what's your name? And she's like, come on, you know my name, like you see me every day. Well, I don't know who you are. You come in with different hair every day. Now she just now telling me this. She's telling me that she just held it in. And one day she came home just crying. I'm like, what's wrong? And she's like, I'm sick of this. She's like, it's been going on for too long. Like she had a substitute at the high school. Like, again, she stayed to herself. She sits in the back, she read it on her phone. That's all she do. Pointing her out. Like, hey, what are you doing? What are you doing back there? What do you bring? Some hip hop? Like she looking like, what? You know? So she has experience. So me as her parent, I have to teach her not to bottle it in. I said, now I could go up there, but you're not gonna get a good, outcome. And I want you to graduate. I said, so I taught her to do it, politely and respectfully. She said she's gonna wait till the last day of school. but I just told her to show them, killing with kindness. You graduating with honors, a full scholarship, and a CNA at 18. I said, hey, killing with kindness and keep moving. So that's how I teach her. I just had to throw that in there because it fit.
Absolutely. Thank you so much for sharing that, Jamie. And it's especially sad when it's happening to our youth. So sad. So as you said, just do your best to lean into the discomfort and teach people and try to educate people. So thank you all for staying on for that video, and thank you all for sharing. I'm so happy you all were sharing with the group. And I hope we all learned something today. So I will go ahead into closing remarks now. As I said earlier, be on the lookout for the coalition contact list I'll be sending out. And I'll also be sending out a new survey on in-person meetings. So please fill that out, as it will help us determine how and when we return to in-person meetings. And finally, our next meeting is Wednesday, June 9th at 10 a.m. And I hope to see you all there. Thank you so much for joining us today, you guys. I hope you have a great day.
Thank you. Have a good day.